Hi there, Dr. Jim Kambeitz here with Kambeitz Chiropractic. Today we're going to talk about neck pain, shoulder pain, rotator cuff pain, carpal tunnel, numbness, tingling. All those pains and discomforts really originate and come from the neck. And specifically we're going to talk about how in the neck area the nerves coming out of the neck here can go down and innervate those certain areas. So in chiropractic care, what we do is we look at an x-ray first of all to see how are the vertebrae lined up. If a vertebrae is misaligned or stuck, then what it can do is it can pinch that nerve. And that's why you can have neck pain, and that can also progress into shoulder pain, numbness, tingling, carpal tunnel, all those types of things, because the root cause is in the neck. So we take an x-ray to see how the vertebrae are lined up, because if there's muscle tension and tightness, it's due to inflammation and choking and putting pressure on that nerve. So if we look at the nerve chart over here, what we're looking at is how the nerves come out of the neck area. So when the nerves come out of the neck area, they travel down to the shoulder, into the elbow. So a lot of golfers' elbow, tennis elbow, wrist, hand pain, that can all be traced right back into the neck area. And this is very important because a lot of times healthcare professionals, other providers may just work on the elbow area or the wrist area or the shoulder area. In chiropractic care, the reason we get such great success is because we take it back to the root cause, and that's typically in the neck area. It's like stepping on the dog's tail, the bark comes out the other end. So we try to go back to the source of the pain and discomfort. So we're going to look at a scan here and something that we do in our clinic to measure these things. And one thing that we do is we roll this instrument up the back, and that measures heat and inflammation. So it'll tell us where's there heat and inflammation in the body here, and then it'll read up with a color. So a white is in the standard deviation of normal, green is mild tension, blue is moderate, and red is severe. So it lets us know where there's heat and inflammation. We then use two other sensors here in the clinic, and these sensors will also go down on both sides of the spine, and that'll tell us where is there muscle tension in the body. So again, it'll tell us with a color. The length of the bar graph tells us how much tension is in there. And then you can see down here, you'll see how there's more tension in the neck area up here. Down here, it'll tell us symmetry. So it'll tell us which way that vertebrae is pulling and to what degree and a percentage. So for example, in the neck, we can see, is it upper neck, is it lower neck, and why is it causing certain problems in the body. So that's why it's very important to be very thorough, and that's what we do here in the clinic, is measure the top 3 aspects of the neck, which is neck range of motion, how are the nerves firing, the muscles, joint, disc. Those things are all important.